Yeah, what I'm looking to do is right now we estimate we have between 10 to 20,000 different healthcare plans in the state for public employees, people whether they work for a city or a county or a school or the state. And really the concept is just to expand what the state does now. We provide healthcare insurance and good healthcare insurance for 50,000 plus employees. Why not just take that vehicle and say, look at the schools and cities and towns, we'll manage this for you in our pool. And with a pool that big, which would for active employees, it'd be over 400,000, but with dependents and retirees, you're looking at over 1 million people. All of a sudden, you start getting some real economies, efficiencies from that economy.
What type of pushback are you getting? And from whom?
The labor groups think it violates collective bargaining, and to address that, I put 4 members on the 13-member board that would oversee this plan from labor, so that they'll have representation on labor. And in some ways, they'll have more of a voice than they have today, because in most instances, labor is not negotiating the design of the benefit. So I would say, look, get to the table. You can participate in designing the 6 to 10 different plans we'd have. And then they can still negotiate at the local level and who's eligible, what plans can you choose from, and what's the premium share that the employees would participate in.
Do you see a conflict of interest between the MEA and MESSA?
I don't know if it's a conflict of interest. I think that they have a bargaining advantage over school boards, people that run for the school board because their kids in band or on the football team. I don't think they went there to get in big labor fights. And so I think that they have the right to have their health care, what I think they describe as a VIBA. And if it's cost competitive, they should be in the game and able to compete and bid. I just hope that the balance of power is appropriate, and I think that's a fair question for us to look into.
Okay. What do you think are the chances of this passing?
I think it's, in these difficult times, it has a chance. I mean, I wouldn't promise that it's going to get through, but in some form I think you'll see something.
Are the savings immediate?
Depends. If we're not going to blow up existing contracts. So if someone's contract is expired and they're open for rebidding, then they'll see savings immediately, in my opinion. But if there's an existing contract that has 2 years to run, that particular city or school district would have to wait for that contract to run out.
And what are the savings?
We estimate over $1 billion. I've used the number 900 million, but that's just as it relates to health care. And it doesn't touch dental and vision and disability and life insurance, and it doesn't count the savings that you get on the administrative side by the hospitals and the providers, who now will have standardized plans that they understand and don't have to figure out the thousands of different plans and the co-pays and eligibilities.
Okay. Anything else you'd like to add?
That's good. No,
okay.
thanks. Thank you.